स्टॉप। क्या आपके पेट के अपर पार्ट में अचानक तेज बर्निंग पेन होता है और खाना खाने के बाद पेन ठीक भी हो जाता है और ये सिलसिला बहुत दिन से होता आ रहा है? तो बॉस, ये सिंपल एसिडिटी नहीं है, यह एक प्रकार का पेप्टिक अल्सर हो सकता है। सो today's topic is peptic ulcer. It is defined as an open sore in the lining of stomach or duodenum, minimum 5 mm in size, then it's called peptic ulcer. The types of peptic ulcer. First is gastric ulcer and second one is duodenal ulcer. In the gastric ulcer, pain worsen after meal, and in the duodenal ulcer, pain relief after meal. The major difference between the gastric ulcer and duodenal ulcer. Okay. Now the sign and symptoms of the peptic ulcer. First is burning pain in the upper abdomen, vomiting, nausea, maybe weight loss, and bloating. These are the symptoms for the peptic ulcer. And then complication. Complication are the bleeding, perforation, obstruction can happen. And now the cause of peptic ulcer. The most common cause of peptic ulcer is pylori bacteria, also nsaids, non-steroidal anti-inflammatory drugs for painkiller we take, and cigarette smoking, also alcohol consumption. These are the causative factor for peptic ulcer. Now the pathophysiology. When imbalance between defensive mechanism and damaging factor. Defensive mechanism are mucosa, bicarbonate ion, and damaging factor are H. pylori bacteria and hydrochloric acid. Let's example. When H. pylori bacteria infect your gut, for NSAIDs you taken for the painkiller, then it then they cause the mucus barrier breakdown of stomach or duodenum. So acid, that is HCl, burns lining your stomach or duodenum that lead to sore develop and peptic ulcer form. Now the diagnosis. How can we diagnose uh, the peptic ulcer disease? First is upper GI endoscopy we can done, and testing for H. pylori bacteria, because H. pylori bacteria is most common cause of peptic ulcer. Now the last is treatment of peptic ulcer. Some drugs like S2 blocker, ranitidine, famotidine, proton pump inhibitor like omeprazole, pantoprazole, prostaglandin analog like misoprostol, and the anticholinergic drug like pyrinzapine, telanzapine can be used. Antacid, you all know that antacid like aluminum hydroxide and magnesium hydroxide. Ulcer protective drugs, uh, things like sucralfate and colloidal bismuth substrate, that is CBS. Anti-H. pylori bacteria drug like clarithromycin, amoxicillin, and metronidazole. These are the drug can be used for the treatment of peptic ulcer. Triple drug therapy nowadays used uh, in this one PPI plus two antimicrobial agent are used like CAP is a mnemonic, C4 clarithromycin and amoxicillin A4, and P4 proton pump inhibitor like omeprazole, pantoprazole can be used. So thanks for watching.